Hi, everyone. My name is Sam Guild. I am the Executive Director of AIM at Melanoma. I want to thank all of you for joining today. For those of us who are on the West Coast, it's still the afternoon, and so I know you're taking time away from work, your families, whatever it is that you are doing at this time. So thank you for joining. And those on the East Coast, I know it's been the end of a long day. So thank you. I want to thank, of course, the Cleveland Clinic. We threw this together because we know how important it is to get this information out to you. No matter what is going on in the rest of the world, we are still dealing with individuals who have been diagnosed with melanoma, will be diagnosed with melanoma, and we want to make sure we continue to meet the needs of the melanoma community. So I want to thank the Cleveland Clinic and all of its speakers for taking time and joining us. I want to go through a couple of quick administrative issues. So we really want to make this an interactive discussion. So I know we're not in person, and so normally in person we would give people an opportunity to ask questions, and we want to do that this afternoon as well. So there are two functions that you can look that are at the bottom of your screen. The first is a chat feature. Feel free to use it and to reach out to people who are joining, to the panelists if you've got questions. If we don't respond, it's not because you're being ignored, but it's because we are either listening to what others are saying, but we will all try to get back to you when we can. The other feature I want to mention to you, there's a Q&A function. There's like two little bubbles, like little speaker bubbles. That is the Q&A. That is where you can ask your questions, and we will do our best to get to all of them. We are also live streaming this event through Facebook, and so for those of you who are watching us through Facebook, please also feel welcome to ask your questions in a comment below, and we will be looking at those and bringing them over to the panelists. And then one last thing, immediately after the event, we are going to be sending out a survey. Please take the time and complete it. It's not very long. We are going to continue having these events. Actually, in fact, the next one is in about 3 weeks. And your feedback is very helpful in creating this programming. So without any further comments, I want to first introduce Dr. Pauline von Chain over at the Cleveland Clinic. Thank you.
Hi, everyone. Thank you for joining us. Hopefully this will be fun and informational. Please feel free to interact. I know it is kind of a funny format, but we see you guys. And so please feel free to send whatever chats you'd like or questions. As Sam said, through the questions are probably the best place to send. So all the speakers some have short speeches and some have a little bit of a PowerPoint. So I'm going to introduce our next speaker, which is Chungmin Song. She's a nurse practitioner here at the Cleveland Clinic. She is amazing for those of you who have met her in person. And she actually runs an early stage melanoma prevention and awareness session. And so she will be talking about being proactive and protecting your skin as we go into summer days. So I would love to introduce Chung.
Thank you. Hello, everyone. I thank all of you for tonight, this afternoon, and AIM for this great webinar event. Today, I'll talk about how to protect your skin. We all want to live healthy and live well, and there are many advices from various resources. As you see, my outstanding colleagues will talk about some of this. To stay healthy, what can we do to reduce the risk for melanoma? Let's review some risk factors for skin cancers, melanoma. There are personal history, family history of skin cancers, skin types, sun-sensitive skin types, light-colored eyes, light-colored hair, unusual moles, and compromised immune conditions from disease or medications, sun exposed, and tanning beds. They're all risk factors for skin cancers. Among these factors, we can control this too to reduce the risk for melanoma. First, no artificial UV radiation. Even one time indoor tanning bed increases the risk of all kinds of skin cancers. If any of you own tanning salon, please don't take it personally. I wanted to remember this picture if you have any options to go. Let's see what we can do to protect your skin from ultraviolet radiation. When you see this picture first, I hope you got the shade. Stay in shade between 10 a.m. and 4 p.m., the peak hours of sun intensity. Cover you up. Clothing with the ultraviolet protection factor protects your skin constantly over time. UPF 50 allows just 1/5 of UV radiation to reach your skin. A hat with wide brim, 3 inches or more all around, is best because it helps to shade your eyes, ears, face, and neck. I know wide brimmed hats are not the most fashionable items, but it works. And you want UV protection eyewears to protect your eyes and skin around eyes. Any clothing or sunglasses leave some skins exposed. Regular clothing or shorts will leave your skin unprotected. So you need more than one method. That's sunscreen. You need to use sunscreen as directed. You need broad spectrum, water resistance, sun protection factor 30 or higher. SPF 30, if you use it, it would give protection 30 times longer than if you don't wear sunscreen. You apply it generous and evenly. You want to apply it where it's all exposed to sun, face, lips, ears, hands, feet, and back of your neck, besides your eyes. You need to apply it at least 20 minutes before you go out. Reapply it every 2 hours, especially when you're outside. Immediately apply it after swimming or excessive sweating. What else you need to know more about the sunscreen? You should put sunscreen on babies if they are older than 6 months old. Before 6 months, use the shade, hat, long sleeves, long pants, etc. You should apply sunscreen on cloudy day because sun can penetrate through the clouds, windows, and more. FDA requires all sunscreens retain their original strength up to 3 years since you open the bottle. If you don't see the expiration date, please put the date when you open the cap. You need extra precautions when you're near sand, snow, or water because it reflects sun even more. I want you to stay healthy and I want you to be proactive. Thank you. Okay.
So we already have our first question. Excuse me. You made it within 5 minutes. Excellent. So the question here is from an early stage melanoma survivor, sounds like. The question is the goal to avoid any change in skin color to prevent future melanoma or just to avoid sunburns? So, you know, after 4 p.m. when the UV is lower, do you have to still wear sunscreen?
Yes, I would recommend to wear sunscreen when you see the sun. You have less intensity doesn't mean that you will get radiation, the UV radiation. So please, yes.
So while we're seeing if other questions are coming in. So in terms of protecting skin, Chung, what do you think the most important thing is for, if people were to take away one thing from what you were talking about, what do you think the most important thing is?
Increase the awareness. So what method you choose, just be mindful to protect your skin when you're outside. As an Asian, we do sunscreens to avoid aging more than skin cancers. So wear sunscreen all the time, but it actually prevent so I think the awareness is very different here. I really appreciate the sunshine since I've been in Cleveland, but you have to be mindful that you need to protect your skin. I think we have a second question.
I have another question actually before we get to that. So what about sun protective clothing? Chung, can you talk a little bit more about that?
Oh yeah, there are so many different brands. Usually they're long sleeves. It's breathable. The material is actually keep your skin cool. I cannot recommend any brand, but you will find many different colors, designs.
And people often ask this, do you think that you need to put on sunscreen if you have the sun protective clothing?
Usually recommendation is no, but you need to apply it when your skin is exposed to the sun. If you happen to have a regular clothing, you need to apply sunscreen underneath the clothing.
So, let's see, oops, well, a couple of questions here. Let me just take a look and see if I can find them. What is the main ingredient we should look for in sunscreen?
There are mineral and chemical in sunscreen. So I recommend you need to take some trials and errors to find the right sunscreen for your skin. Now, sorry, I'm lost this. So I cannot tell you what ingredient you're looking for, but they are.
Maybe if you talk broadly about mineral sunscreen.
So the mineral is in the baby's sunscreens. It usually leaves the white cast on the face. It's usually less irritant on the skin. And usually for adults, they are mixed. And some are just a chemical portion to it. So you need to be aware of what suitable on your skin.
And then I'm gonna take one more on sunscreen, and then we'll move on to the next speaker, so we have enough time. And I see a couple of questions. I'll be typing some of those answers. But the last question for this session, let's do, what's the max SPF for adults?
I think it was 100. More important thing is that you need to reapply it. So as I explained, if you use SPF 30, it protects your skin 30 times longer. So if you have a skin type that you get burned in 10 minutes, you multiply 30 when you use SPF 30. So it takes about 300 minutes to get burned. So if you use 100, it takes that long time. But some people said because it would have more chemicals, it may harm on your skin. The recent recommendations from dermatologists, even Dr. Fontaine, said just use 30, SPF 30, and reapply it every 2 hours. People tend to forget to reapply it when they use a higher SPF. So that's what my answer is.
Fair enough. So I guess let's move on so we can get all the topics in.
Okay.
So thank you, Chung. And thank you for all those questions, everybody. And you'll see some of you will see some answers getting typed out in the next section. So now I'd love to introduce Mary Toll. She is a nurse practitioner with the Melanoma Group, and we love her dearly. So she is now going to talk about skin self-exam.
Hello, thank you. I'm just going to do a couple pointers on doing self-skin checks. So the best tip I heard recently was to evaluate all the areas of your body that are covered in skin. So I think the take-home point is to make sure that you're not only examining at home sun-exposed areas, but also, you know, behind your ears, your nail beds, body folds, things like that. For a self-exam, I thought I'd start a little bit with what kind of a normal mole looks like. So it's normal to have about 10 to 45 moles, so everybody can see this picture, on your skin. Most moles appear in childhood or adolescence and are usually less than 6 millimeters, tend to be round or oval, kind of like this one here, and symmetric, usually one color. They can be flat or raised. The color can be anywhere from skin colored, brown, black, blue, pink, or sometimes it can be colorless. They usually do not change from month to month. But to look at some things, so we talk about the A, B, C, D, E's of melanoma, which I'll go through these because I'm sure not everybody can see this, are worrisome characteristics for a mole. So A stands for asymmetry. If you fold the mole on top of itself, one half should look like the other. Melanomas are frequently asymmetric. B stands for border. Melanomas typically have an irregular or notched border, scalloped, or sometimes they have a poorly defined border. You can't quite tell where the mole begins or ends. C stands for color. Melanomas frequently have multiple colors or are two-toned. They sometimes include colors such as gray, black, white, or red. And we sometimes talk about the ugly duckling mole, which, you know, in your normal moles, you have a normal kind of shape and color. Sometimes the color can just be a shade or two darker. D stands for diameter, which is about anything, you know, larger than 6 millimeters could potentially be concerning. And that's about the size of a pencil eraser. But I think the most important one is E for evolution or change. Any moles that, you know, change any of those qualities should be noted. To do a self-skin exam, there's multiple different ways you can do a self-skin exam. I'm kind of going to go through a quick way that's similar to how I do my skin exams in the office. But you know, simple, you need a bright light, full-length mirror, a hand mirror, a chair is optional, so you can look at the, you know, lower part of your legs, the soles of your feet, in between your toes. Sometimes it's helpful to have a family member or a friend help assist you to look at your backside. You can also bring this up. Download a body map off the American Academy of Dermatology, which is really helpful. Probably can't see this, but it shows you can make notes of lesions, moles that you're concerned about that you want to keep an eye on. So I think the most important thing about doing a skin exam is to do it the same way every time. So if you're doing this at home, if you start with your back normally, I would always start with your back. You'll be less prone to miss different areas. So I usually recommend starting with your trunk. You want to look at the front and the back side of your trunk. Make sure you lift up your arms so you can see your sides. Obviously, you'd want to use a hand mirror to you know, look at your back side. And also remember to lift up your breast to look at the underside of your breast. And then you can start with your extremities. Start with, you know, your arms. You want to bend your elbows to make sure you see both sides of your arms, your underarms, all the way down to your hands, including your palms, in between your fingers, And if possible, you want to avoid polish so that you can see the skin on your nail beds. And same approach with your legs. You can start from the top down, both sides, and then make sure that you look at the soles of your feet, the web spaces in between your toes, and again, avoid polish to look at the skin of the nail bed. And then finally, your head and neck. So you can use a hand mirror, which I have a hand mirror here, which is proportionate to the size of the computer screen to make sure you can see the back of your neck and your head. I also read a tip to use a hair dryer. So in the office, we usually section the hair in parts, but a hair dryer can help you kind of section and get a good look at your scalp. Things that you want to look for besides the ABCDEs that we talked about, or anything that's grown, increases in size, or suddenly appears raised, curly, or multicolored, any spot or sore that isn't healing within a couple of weeks. There is a scab on it, it's bleeding, and then any mole or birthmark that has changed in any quality. It becomes painful, itching, and again, changes in those ABCDE categories. I usually recommend doing a self-skin exam once a month. Moles usually don't change from month to month. So if you do see something change, you can document that either with a camera or the body map, and then of course, contact your dermatologist. Most melanomas diagnosed and treated early are, the cure rate's close to 100%. So it's important to, do your skin checks at home. And at this time, I know part of the concern was with, coronavirus and being quarantined, getting out to do skin checks. At this time, at least at the Cleveland Clinic, we've opened services to do skin checks for patients with history of melanoma and history of skin cancers. There also are several options available, electronic options, including sharing a photo or doing a virtual visit, much like this, a Zoom visit, or FaceTime, Google Duo, or similar app. That's it.
Thank you, that was awesome. So there are already questions. Not surprising. You guys are awesome. Very interactive, so keep it up. So I have a question here. It is a person who is being checked every 6 months, and they would like to know if they still need to do home exams on top of that. Also, after surgery, noting that there are a lot of skin cherries, and are those normal?
So I would definitely recommend continuing to do the self-exams. Like I said, normal moles don't change month to month. So, if you note a change from one month to the other, you can definitely reach out to, your dermatologist and get a closer examination or possibly a biopsy if needed. And then second part of the question was it about scarring?
Skin cherries after surgery.
I'm not sure I know what skin cherries are.
I'm guessing red dots. I guess you could talk about post-surgical changes that are common after surgery on the skin.
It is, normal after your incisions heal. Incisions usually take a good 4 to 6 weeks to heal. Skin cancer incisions tend to be larger, so sometimes they can take 6 to 8 weeks to heal. It is normal to have some redness and elevation at the level of the scar, and scars can take 12 to 18 months to fully form. But if there's any continual non-healing area, like a continual scab, that might need to be evaluated additionally. It might not be part of the normal healing process.
All right, so how about, we'll do another question, and then I think we should probably get on to the next. How often do you recommend for self-exams, and how about after being a survivor for 10 years, do you still need self-exams? or exam?
So I usually recommend a monthly self-exam. And then, you know, your skin checks with a dermatologist. At 10 years, we usually recommend, after 5 years, usually once yearly from if you've, you know, had melanoma. So, you know, I think a monthly self-exam, it probably takes all of 5 minutes. So I think it's well worth it. But definitely a yearly exam with your dermatologist, as well as your first degree relatives.
Agree with that. And thank you for whoever answered or who asked the genetic question. So let's move on. Actually, I have to figure out who is next. There we go. So we'll move on. Thank you, Mary. So we have a couple of great sessions coming up. So the next is Joseph Dowdle. So he is one of our registered dietitians. And his topic is to talk about nutrition during melanoma treatment and recovery. I know a lot of people ask us diet questions, so I am actually very much looking forward to this.
Yes, thank you so much for having me. I hope everyone, let me just get this started here. I hope everyone's having a good day. And thank you, AIM, for having me speak on the nutrition side of things. So as she mentioned, I'm going to talk about optimizing nutrition during melanoma treatment and recovery. So just a little disclaimer, nutrition is very, very individualistic, okay? And I always try to mention that to my patients because not one diet fits all, depending on any sort of chronic conditions, surgical histories, anything of that nature that can really change the course or the drive of nutrition from patient to patient. So it's always important to remember that nutrition is very individualistic. I do plan to discuss common nutrition-related side effects and ways to combat them during treatment. I'll discuss nutrition and activity recommendations for cancer survivors, as well as some foods that can potentially protect your health during any sort of recovery. So diet during cancer treatment, there's two main goals, and really the two main goals are managing side effects and maintaining weight. We all know that any sort of treatment has significant side effects associated with it, whether it's nausea, vomiting, diarrhea, constipation, so on and so forth. And a lot of these things can be prolonged or be inhibited by nutrition. So really it's trying to understand what foods do what when, and when you should apply some foods. And again, maintaining weight. You know, calorie and protein needs generally increase during treatment, not all the time, but for the most part they do. And weight loss during treatment is generally a result of muscle mass loss, not so much body fat losses. You know, a lot of times patients will tell me, you know, I lost 15 pounds, but I wanted to lose that 15 pounds. Well, it's great if you're making, you know, healthier choices or you're maybe exercising more, but losing weight because you're having any sort of side effect that prevents you from eating is the weight loss we don't want to see. That's the malnutrition. Okay, so we don't want to be losing that lean body mass. Even small amounts of weight loss can sometimes change treatment outcomes. You know, there's a lot of different things that, you know, your team does in order to treat any sort of cancers. And sometimes any sort of significant weight loss can really adhere or make it challenging to treat that chronic condition. If you're not feeling well, you really need to manage those side effects, okay, and make sure that we're getting enough calories and protein in, even if this means consuming foods that are traditionally viewed as unhealthy, okay? I always tell patients, if it comes down to not eating or eating a Wendy's Frosty, I'd rather eat the Frosty than not eat or skip the meal. You know, the calories are more important than sometimes where it's actually coming from. Yes, from a long-term perspective, are those things necessarily healthy for us? No, but sometimes it's very necessary at the time when we're looking at specifics as far as calories and protein is concerned. Restrictive diets can sometimes lead to weight loss. So if you Google anything on the internet when it comes to nutrition or any sort of cancer treatment, you know, there is a ton of diets that pop up that say this is the one that's going to cure, this is the one that's going to beat it, this is the one that's going to prevent growth. And a lot of times those restrictions or those preconceived notions can sometimes, you know, cause more harm than good. So it's really, really important to make sure that you're following up with any of your team and asking these questions so that they can give you the best answers based on research. Food safety is of utmost of importance, especially during this time, but even during times of cancer treatment. You're more susceptible to any sort of foodborne illnesses, okay, because that immune system is, suppressed. Older times, we used to talk about the neutropenic diet, which we would eliminate fruits and vegetables, and we would eliminate anything fresh, where nowadays we're starting to see that that's not really that important. It just comes down to making sure you're washing things well. Common sense type stuff, changing cutting boards, not cutting raw meat on the same cutting board as fruits and vegetables, washing knives, so on and so forth. One quick, easy at-home remedy as a cleansing technique is to take 6 cups of water plus 3 tablespoons of vinegar, and that is your natural cleaner. So the fruit cleaners that they sell in the grocery stores that are $7.99 a bottle, this is your 49-cent version of it. So poor appetite and early satiety are probably the 2 most common things that patients tell me. Maybe you just don't have the desire to eat, or maybe you're just getting full very, very quickly. The first and foremost way to combat that is through small, frequent meals. And I always tell patients, the smaller we can make meals and the more we can work on just having little increments along the day, we're still going to get to the same number of calories. We're still going to get to the same numbers of protein, but we're not going to force a high volume on our gut. Sometimes eating towards the clock. Food is medicine. And just as we take medications at certain times during the day, every 2 to 3 hours, you have to take a dose of food. There's no skipping, there's no prolonging. We have to make sure we're getting these nutrients in to make sure that our body's recovering the way that it should. We always want to incorporate protein at each meal. Sometimes eating larger amounts of high calorie foods in the morning time or when you're feeling most hungry is one way to help to increase those numbers. And sometimes beverages with calories help with that as well. Taste changes is another big thing that patients tell me is, food just doesn't taste the same. Sometimes it's metallic. Sometimes, foods are way too salty that didn't used to be salty, or sweet that didn't used to be sweet. And there's a lot of different ways to flavor foods. With a metallic taste, acidity is flavor. Okay. And a lot of times I tell patients that if you watch any sort of cooking show that's on TV, they're always starting with an acid, some sort of citrus to help to build flavor. It's the same way when it comes to masking flavors during any sort of taste changes. You can get rid of a lot of taste changes and help to build flavor back by using an acidic base. So whether that's lemon or lime, sauces, tomato sauces, so on and so forth. Sometimes zinc can help with increasing taste in patients. It's not necessarily a 100% positive outcome. It's hit or miss for some patients. So if you are taking zinc, or if someone does recommend a zinc supplement, you got to be making sure that you're cycling it, because sometimes this can lead to a copper deficiency and prevent copper absorption. Dehydration is also a very common side effect. All right, so you want to make sure you're drinking small amounts as often as you can. Again, prolonging intakes across the day. Good choices include, water, sports drinks, flavored waters, so on and so forth. Sometimes, those beverages that have calories with them, fruit juices, milk, all those things can help to hydrate. Sometimes too much sugar can actually dehydrate. Okay, so sugary beverages, things like too much juices, can actually cause more of a dehydrating instead of a rehydrating. Foods with high water content also cause or can contribute to hydration. Watermelon is the first thing that comes to mind. It's like 80% water, so that can also contribute to making sure that a patient is hydrated. So foods that have protecting qualities are going to be all our fruits and vegetables. Okay, so all those colors on a fruit and vegetable are what we call phytochemicals. Okay, or plant compounds that promote healthy tissue in the body and support the immune system. Okay, so the orange color, for instance, with carrots is beta carotene. Bright red with any tomatoes is going to be lycopene. Sulforaphane for your cruciferous vegetables. All those things have protecting, immune enhancing qualities to them. So those are always going to be great for our health, unless there's some sort of other issue that's going on, whether it's digestive or a surgical history or something. So the American Cancer Society always gives guidelines for nutrition and physical activity. We always want to achieve and maintain a healthy weight throughout life. We want to be as lean as possible without being underweight and avoid any sort of excessive weight gains at all ages. Even small amounts of weight or weight loss do have health benefits when it's appropriate. So during treatment, as I mentioned, it may not be appropriate to be losing weight. After treatment, during recovery, those may be the times to where we want to, get our health in check and really focus on reducing our weight if we are overweight or obese. We want to be physically active if we can be. For adults, that needs at least 150 minutes of moderate intensity a week. For children, that's at least 1 hour activity each day. We want to include some sort of strength training 2 times a week, limit sedentary behavior. Doing really any physical activity above usual activities does have health benefits. So usually what I tell patients, if you're used to, pulling up to the mailbox to get your mail, maybe try walking to the mailbox to get your mail. Even that little movement is something in the right direction to get your body getting up and moving around, doing something outside of your norm. We want to eat a healthy diet with an emphasis on plant foods, more fruits and vegetables, more whole grains, more fish and poultry, nuts and seeds, olive oils, low-fat dairy options, those types of things. Mediterranean, guidelines, if you ever heard of the Mediterranean diet. So just some key takeaways. Nutrition plays a critical role in symptom management. Again, everybody is their own individual, and every nutrition intervention should be individualized. Overall diet balance is best for survivorship. So less sugary beverages, less high-fat processed foods, more lean sources of protein, more plant-based proteins. Eat the rainbow, not Skittles. And any questions?
All right, so we already have a question, I think, that came through on the chat. So talking about diets like keto or low sugar diets, we get this question all the time. Can you comment on those diets?
Yes. So, sugar gets a bad rap, and a lot of times sugar is one of those things that we tend to kind of use as a scapegoat. Our body fuels itself on sugar. No matter what we eat, it's going to get broken down into sugar. So there is no way to completely eliminate sugar from the diet. Should we be adding, Fruity Pebbles and all these added sugars, that sugary products that we generally give to kids? We shouldn't be doing that on a daily basis, no. But, having those things every now and then isn't going to make that big of a difference. The keto diet is probably one of the most popular things that's in the news right now. It's mostly getting looked at in the brain cancer area and how ketones can sometimes help to prevent cancer cells from building in the brain. But currently there's no accurate substantial research that shows that a keto diet can prevent any sort of cancer.
Well summarized. So some other questions, let's see. How about vegetable fruit supplements like Total Greens?
So again, you just want to be looking at each individual label. The thing with supplements is a lot of times they're not regulated, okay? And the government really doesn't have a whole lot of regulation as to what the company is actually putting in the supplement. So, you really want to do your research on it and make sure that, there is some sort of regulation that's happening. Usually there's going to be some sort of seal that's on the front or on the back of it. My biggest thing with any sort of supplement is just making sure that there's no interactions with any medications that you're taking. Because a lot of times supplements can have either a prolonged effect of medications, meaning it's going to make the medication stronger, or sometimes it can actually reduce the dose of the medication. So you always want to check with your physician or team about that.
And another popular question that we get a lot, what about intermittent fasting for weight control and or cancer reduction?
So again, that's another popular diet that's in the news. Again, it's very limited research-wise. We know that, fasting or having, limited amount of calories over a certain period of time is going to cause some sort of weight reduction. It's just our physiology that causes that. A lot of times it can be water weight. So you want to be careful to make sure you're not dehydrating yourself. I think it almost falls in line with the, smaller meals type of concept, to where you're not necessarily having high volumes of food at once. You're prolonging things as opposed to, again, trying to do high volumes. In cancer, it's still very, very limited in research and if it's positive or not. I think the biggest thing is what's hindering it is we don't know the long-term health benefits of it or the long-term effects of it. Does this have any sort of effect on any other organ? So I always advise patients not to fast during any sort of cancer treatment. It's a lot easier to maintain muscle mass, a lot easier to maintain your calorie and protein needs just by following that small, frequent sort of plan.
Let's see, and there's a bunch of, oh my, you're very popular.
I had a feeling that this was going to happen.
Let's see, how about whole fat as opposed to low fat in dairy products?
So low fat dairy is always going to be more survivorship, more lifestyle change. Skim products, 1%, reduced fat versions of things. Those are always going to be healthier in the long term. Whole fat products we shouldn't be having during times of survivorship or just normal health. Sometimes during treatments we use those products because they're higher in calories, and when we're dealing with a patient that may get full very quickly, we got to make sure we're counting every calorie and making sure that the volume is as low as possible while still being able to meet their needs. So during specific times I would say it's okay, but in the long-term effect you want to focus more on the low-fat sources.
Okay, I'm going to answer, I'll have one other question, then we'll move on. So can you recommend a place where people can find some good, simple recipes?
So any of your major government organizations. So the American Cancer Society has a lot of recipes on their website. I always tell patients to go to heart.org, which is the American Heart Association's website. They have a lot of resources and recipes available that follow more that Mediterranean diet guideline. A lot of those low-fat, lean sources of protein, those types of options. Very, very patient-friendly website. So I would always push patients to go in that direction and use that as a base. They also have cookbooks available and can recommend any sort of cookbooks that are made by outside sources other than the American Heart Association. But it's a great user-friendly website.
Awesome. We'll paste it out to the chat so people can see it. Thank you. That was awesome.
Great.
And there's
Thank
still
you.
some more questions. We'll try to answer them with typing. So I'd like to introduce our next speaker. So another popular topic besides diet we get all the time is just to talk about stress and anxiety. I mean, the experience of cancer, no matter what stage it is provokes a lot of feelings. So we have Carly Temple on. She's a licensed social worker. She's been amazing and for those of you who know her, she's been amazing. And so she'll talk next about coping with stress and anxiety.
Hi, everyone. Thank you so much for that introduction. As Dr. Funchain mentioned, I'm a licensed social worker here at our Cleveland Clinic Cancer Center, working specifically with our melanoma patients. Today, I'm going to be talking a little bit about stress and anxiety. I have a lot of content, so I'm going to try to fit it all in. And this is really for people at any stage, whether you're newly diagnosed, in active treatment, survivorship, even caregivers, loved ones, anyone supporting someone going through treatment or who's diagnosed with melanoma, really for everyone. So I'm going to start by talking about the differences between stress and anxiety, because there are some differences. With stress, I like to think of it as something influenced by an external trigger. So that could be something like losing a job, getting into a car accident, anything where there's an external event. It can be short or long term. The things I just mentioned would be more short term. Longer term things could be something like poverty. Anxiety, on the other hand, anxiety can happen without the influence of an external trigger. So this is a sense of just feeling constantly worried, ruminating, a fear of the future, worrying about the past, things where you're just feeling that way and nothing necessarily happened. Both of these things, both stress and anxiety, can have similar long-term effects, like sleep issues, fatigue, difficulty concentrating or remembering things, irritability. I also want to mention that some stress and some anxiety can even be helpful, and it's certainly part of the normal human experience. Experiencing a certain amount of stress can encourage problem solving, it can encourage growth, and eventually lead to better resiliency. So I don't want anyone thinking, you know, I shouldn't ever feel this way, because a certain amount of stress and anxiety is certainly part of the normal human experience. So now that we understand a little bit about the differences between stress and anxiety, I want to talk about just developing a habit of checking in with yourself. So at a basic level, checking in with yourself, if you're starting to feel anxious or stressed, just trying to name that feeling. You know, are you feeling worried? Are you feeling fearful? Where in your body are you feeling that? What are you feeling? Just trying to really name that. If it's helpful for you, write it down, keep a little journal. Otherwise, just mentally kind of keeping track of what you're feeling. And that's at the basic level. At a more advanced level, start to ask yourself, what was helpful when I was experiencing those things? Or on the other hand, what wasn't helpful? And again, either writing it down or just keeping a mental note of, in those moments, what worked for you and what didn't work for you. By keeping track of those things, that's going to help us identify our anchors. And I want to specify anchor because I know sometimes things get a little muffled over audio. So we're talking about the thing that keeps the ship grounded in place, your anchor. So what is an anchor? That is anything that is helping to anchor you in the present. Something that's taking you away from that fear, that worry, that distress. Anxiety often is the result of us worrying about the future or ruminating on the past. So really, to help negate the effects of that, we're going to focus on things that help bring us back to the present moment. So what are some examples of anchors? It can be anything that's helpful for you. So hobbies like reading, painting, cooking, even watching a favorite TV show or movie. And sometimes I have patients tell me, well, I watch movies to help, but that's just a distraction. But I really want to reframe those distractions as anchors as long as you are doing the work of checking in with yourself. Because if you're checking in with yourself and you've identified those things as something that is helpful for you, then those are absolutely anchors, anything that's helping ground you in that present moment. They could also be other things like talking to a friend or family member, exercise, meditation, anything like that that's helping to bring you back to the present moment. So I want to talk about two specific exercises that are grounding, mindfulness exercises that are going to help root us in the present. So the first one I really love, I share this with a lot of my patients, is the 5-4-3-2-1 exercise. And this focuses on using your senses to really help root you in the present moment. So how this works is you're going to start by acknowledging 5 things that you can see around you, anything in your present environment. And just take a moment to look at each of those objects, identify that, and acknowledge those 5 things. Next, you're going to look for 4 things around you that you can touch. And if you're able to physically touch them as well, just to help ground you in that moment, really using your senses. Next, you're going to acknowledge 3 things you can hear, 2 things you can smell, and 1 thing you can taste. I really like this because it can be done anytime, anywhere. A lot of times I hear people say, you know, at home I can, you know, do this or that, but I get really anxious when I'm in the car ride on the way to, you know, my oncologist's office. And so this is great because you can do it anywhere. Now, the next thing I want to talk about is a breathing exercise. And this just focuses on belly breathing, which is really helpful for us. Anxiety and stress can often make us take really shallow breaths, really in your chest you're breathing, and that can exacerbate anxiety. So what we want to do is take a moment to really focus on our breath and really focus on the belly breathing. Now to do this, I don't know how much I can, see if I can scooch back here. You're going to put one hand on your belly and one hand on your chest. And as you breathe in, you want to breathe in slowly. You want your belly to physically push out your hand. And the reason you're holding your hand to your chest too is you want to make sure that you're not doing that shallow chest breathing and having your chest press out your hand here. You really want to inhale your belly and then exhale slowly, and you're actually going to feel your hand sink back into your belly if you're doing it correctly. Now, I like to do this anywhere between 3 and 10 times, whatever is most helpful for you and obviously comfortable for you. If you have a condition that makes that, uncomfortable, certainly don't use that exercise. But anywhere between 3 and 10 times. I also like to count while I do it. It helps to avoid any other distractions if you're counting as well, because really all of your energy is going into focusing on the present moment. Some other support for guided meditations and relaxation techniques. YouTube, I have a lot of patients go to YouTube and just put on some music while they're doing those breathing techniques. There are certainly a ton of free apps out there right now that people have been using. Headspace is a really popular one I know a lot of folks use. And also ask your doctor about specific recommendations. A lot of cancer centers especially are starting to really incorporate mindfulness practices. I know a lot are offering Reiki, things like that as well. So certainly your doctor is also a great resource for different supports, and if you want to get into mindfulness, different things that you can try. And then finally, I just want to mention, these techniques and these ideas might work for some people, they might not. You might need some additional help, and just trying these things on your own might not be enough, and that's okay. So a couple of things you can ask yourself, if you're feeling constantly worried or on edge or having physical symptoms like difficulty sleeping, fatigue and upset stomach, nausea, is your worry maybe out of proportion to what might be happening, or are you feeling really down and hopeless? If you answered yes to any of those, certainly it might be helpful to talk to your doctor. Your primary care doctor, your oncologist, those are great places to start for recommendations or referral. Or if you want to or are able to self-refer, you can actually also call your insurance company directly. They can provide you a list of in-network providers. But again, those are options for trying some things at home. And then again, if they don't work, that's okay. There are always places out there where you can get additional support. And thank you so much. So I'll take any questions.
Yeah, here's a quick one. Could you please repeat the 5, 4, 3, 2, 1 items?
Oh yeah, absolutely. So it's 5 things you can touch. I'm messing it up already. Here we go. 5 things you can see around you. 4 things you can touch around you. 3 things you can hear. 2 things you can smell. 1 thing you can taste. So it's supposed to kind of go in the order that might be easiest. We're clearly not going to be able to taste 5 things in our environment. I guess unless you're out to dinner.
And how long would you expect to spend on that exercise, on the 5, 4, 3, 2, 1 exercise?
It's really as long as it takes you to go through it. I would say take your time as much as possible. Like I said, really getting into it. So for example, the things you can touch around you, if you're able to physically touch them, identify the texture, all of that's really going to help ground you in that moment. So take as long as you can, I would say, and just really take your time with it.
Okay, I'm going to take one more question because our hour is running. This is all, I'm fascinated by all of this. You guys you've been awesome. So so this is very appropriate for this time. Going to doctor visits can be stressful enough. And now that patients are unable to bring loved ones with them, do you have any suggestions for caregivers to help their loved ones?
Mm-hmm. Absolutely. Cell phones are amazing, I will say. If your physician or whatever provider you're seeing is comfortable with it, if you can actually pull up, a FaceTime app or even speakerphone, something like that, so your loved one can still be there with you in that appointment, I would say absolutely do that. It gives you a sense of having someone there. It's also great because that person is going to be able to hear all of the information that you're hearing too. So I would say if you can do that, that's a sense of connection that despite these, wild times now, we're still able to do to some extent.
That's awesome. Well, thank you, Carly.
Thank you
so now we So everybody's sort of favorite, unfavorite, love-hate relationship most of us have with exercise. I'd like to introduce Diana Lindner, who is a physical therapist and has done a lot of great work with lymphedema, which many of you who are in the audience can relate to. And so she will be talking to us about our secret weapon, exercise.
Right. Thank you, Dr. Fuchin, and thank you, AIM. Hello, everyone. It's great to be with you today. Like Dr. Fuchin said, I am a physical therapist, a doctor of physical therapy, and a certified lymphedema therapist. Today, I will not be talking about lymphedema tidbits. I'm actually going to be focusing on that exercise. So I'm going to share my screen here. Oh, where did it go? All right. We'll get it. Sorry about that. Great. All right, now we're ready. Exercise, your secret weapon when you have melanoma.
Okay, Diana, sorry, the screen is not sharing. Can you?
Oh, it's not? Oh,
yeah.
Okay.
Did you click the button on the bottom that says share screen?
I did, but I couldn't find it initially. Hold on, please.
Yep.
Thank you.
So at the bottom of the chat of the Zoom webinar screen, there should be a button that says share screen.
Right, I have to get back to that. Oh, that's embarrassing. Where is it at? All right, let's try this.
It was working before, everyone, we promise.
I know it was. It really was. I had great pictures. So I can't get it, and I don't want to waste time because we want to get up and move anyway, right? That's the whole point of this presentation. All right, so benefits of exercise are known that it helps to diminish your fatigue and your anxiety, reduce depression, and improve one's quality of life. So let's get moving today. Research has confirmed when we have melanoma, we're going through treatments before and during and after those treatments, the benefit of exercise, it helps you to survive and to thrive. So exercise is so critical. We even heard Joseph talk about exercise guidelines, 150 minutes to 300 minutes of moderate exercise is recommended for adults, and then 1 hour for children. So I'm gonna give you 5 exercise tips today. Number 1, set goals. What is your own personal goal? Is it to increase your strength, flexibility, endurance, balance? Maybe you want to walk a mile. Maybe you want to run a little further. What is that exercise goal that you want to achieve? And it's never too late to set that goal. Write it down. Put it somewhere where you can see that goal every day. Number 2, get a workout partner. And I'm sad that you can't see my cool graphic. It's a minion. And so if you can think of a minion, he's saying exercise. And then underneath it says, I thought you said extra fries. So extra fries. So we want to make sure when we get a workout partner that they're going to help keep us accountable to that exercise, right? And achieve that goal that we've set. That exercise partner is going to be motivating, encouraging to you. Social and fun. So maybe once you do that exercise for the day, you can go ahead and get those extra fries. And number 3, put your exercise on your calendar. Schedule it. Schedule it like you would an appointment. We have appointments in our calendar all the time. So why would we treat exercise any differently? And what's great now that we have smartphones, most of us, right? We can put it in as a reoccurring event. So maybe you're going to do that exercise Monday, Wednesday, Friday. You schedule it. You commit yourself to doing the exercise. Number 4, establish a routine. And what I mean by that is you want to warm up, a 5-minute warm up. Get your blood pumping. Get your muscles ready for what you're about to do. Then perform your exercise part. It's recommended it could be either 30 minutes, or if 30 minutes isn't something that you can do for that specific day because life happens, then break it up into 10-minute intervals and do it 3 times. That'll still get you to 30. And then finally, do that cool down. And that cool down could be simply stretching or maybe walking at a slower pace. we really just want to lower our heart rate. Specifically, if we're doing cardiovascular exercise, we want to lower our heart rate back to the resting heart rate. Number 5, have fun. So exercise shouldn't be that task where we're begrudgingly saying, oh, I have to exercise. We should say, I can't wait to exercise, right? We have our goal. We have our exercise partner. We've got it in our planner. We've exercised, but we want to make sure we have fun. So I encourage you to change up your exercise routines. So instead of doing that same walk, the same direction around your neighborhood, change the direction. Maybe go on a hike. Be creative. One fun thing that I've done with my family, I made a list of 6 strengthening exercises. So for example, and I will say when we think about exercise, make sure you're able to perform it and it's safe for you. If something is not safe or it doesn't feel right or you feel like it's causing pain, think about a way to modify it. And if you're having trouble figuring out what those exercises that would be great for you, schedule a visit with your physical therapist. So here's my example of being creative. So those 6 strengthening exercises could be 1, do a plank, 2, a squat, 3, a lunge, 4, a push-up, 5, a wall sit, and 6, a curl up or a crunch. Get yourself 3 dice, roll the first dice, whatever number it lands on, that's the exercise that you'll be performing. Take all 3 dice now, roll them, whatever number combination comes up, you decide. Do you do so many reps or repetitions of the exercise, or do you do a certain time frame or how many seconds? And then the last thing is invite family members to exercise with you. Have fun. So think about when you go to weddings, what are your favorite dances? What do you like to dance to? Is it the locomotion? Is it the YMCA? Is it the cha-cha slide, the electric slide? Whatever it is, dance. You'll be surprised how much fun you have. And the last thing, a shout out to the American Physical Therapy Association. They have both a website and a Facebook page called Choose PT. On their Facebook page, Choose PT, there are videos. You go to the video link, and within the past 7 to 8 weeks, they've uploaded various videos to help you do exercises. Exercise could be exercises on the floor, exercises that you do seated in a chair, standing by a chair, strengthening exercises for both your arms and your legs, as well as exercises for children. So with that, and I'm sorry you couldn't see my slides, I thank you for your time. I want you to stay safe, stay healthy, stay positive, and stay active. Thank you so much for your time today.
Amanda, that was awesome. It was better without slides.
That worked out great.
The energy was amazing.
We got to get that pump up the people, since we've all been sitting for 60 minutes, right?
Right. It's got to be the rah-rah in you. So there are some questions here. Let's see. So any suggestions of at-home exercises that people can do?
Yeah, sure. So the categories, right? So some great exercises, sit to stand. So get a chair, sit on the edge of your chair, stand up and sit down. Squats are always good, but I always caution my patients, when you do your squats, make sure that you keep your knees behind your toes. We never want to have our knees going over our toes. And walking. I mean, walking's so great. Get that heart rate up.
Now, some of our survivors, they have lymphedema, or they're just post-op, and so some of the dear people we see in clinic are a little bit advanced in age, so mobility is not great. So in those situations, how do you keep up exercise?
Right, so that's where chair exercises are great because they're safe. The person can be seated. So great chair exercises could include putting a pillow between your knees and squeezing that pillow, getting some strength for the legs, for the hip adductors. Resistance bands, if patient has access to, putting a resistance bands around the legs and then opening the legs to work on the hip abductors. even sitting and kicking the legs straight out. So that would be for your legs. And then of course you can do arm strengthening with either say a soup can if you don't have weights, or again, resistance bands. But of course it would behooves the patient if you can get to see a physical therapist so they can specify that treatment plan specifically for you, taking in consideration comorbidities and your health.
So I've got a question, but I think it should be a question for everyone. So, and I think we're all going to come online soon. Let me see. Anyone? Are we all coming back online? Oh yeah, see, everybody's coming back. So, so I think we'll answer this question for everyone. So I think a lot of people are asking right now, is it safe to visit any of you in person? So is it safe to visit? So we'll start with you, Diana. Is it safe to visit a physical therapist in person nowadays?
So yes, I'm going to answer, and of course the other colleagues as well can answer. I'm in a family health center right now, and we have 2 options for our patient. Well, actually 3 options. The first is we can do just a phone call. So if you don't have technology and just have a smart flip phone or regular phone, we can talk to you over the phone. 2, we can do a FaceTime. We do it through FaceTime or Google Duo. And then the third option is to come and see us. And we make sure that we keep you safe and your provider safe. Your temperature is taken, you are given a mask, and then it's just you who come into me as your provider, and I'm able to provide you both your lymphedema or your exercise care. And frequent hand washing and frequent sanitizing is happening in my clinic every day.
Awesome.
So, yeah.
That's great to hear. And we've been hearing from some of our folks who have still been seeing you. And we're like, how does that work? It's really great to hear that.
And I'll tell you, yeah, people don't be scared. And physical therapy never closed down. Our outpatient clinic stayed open for the Cleveland Clinic. So hats off to my colleagues.
Yeah, it's great. It's been different depending on where people have gone, especially when you're talking about nursing homes. I think we've noticed differences. So it was really great to hear some people still got care. So I guess I'll go to you, Mary. Is it safe to go see dermatologists for full body skin checks, and are you guys open for business?
Yeah, I think I echo a lot of what Diana said, but it's definitely safe. And I think for patients that are concerned or worried because maybe they're on certain medications or have certain comorbid conditions that they're nervous to come out, we do have a lot of options. In dermatology, a lot of what we do, we have to see. So we prefer a picture or a virtual visit, but we can definitely do phone calls, and, we're doing everything we can to keep dermatology. A lot of what we do, we have to see. So we prefer a picture or.
We have definitely been getting pictures here, and have been able to talk to patients about new spots or moles or things like that. And how about you, Joseph? Are you guys are still seeing patients?
Yeah, so we've been doing everything virtually. So whether it's through a virtual platform or over the phone, to where now we're transitioning back into seeing patients face to face. I mean, kind of to echo everyone before me, it's really just making sure that we're staying 6 feet apart and doing all the hand sanitizing and face mask wearing and all the things that everyone is telling us to do. But yes, dietitians are seeing people face to face.
Awesome. John, how about in the cancer center?
So we see all patients on active treatment, and if they don't have a treatment here in the center, if they have just surveillance scans or toxicity follow-ups, we offer the virtual visit, phone visit, etc. So we still see patients. The first floor, they have all this precaution. They check temperatures, ask if they have any symptoms, etc. So yeah, we have all precaution.
And Carly, I'm going to ask you to speak on behalf of not just the social workers, but all the ancillary services, art therapy, music therapy, if you can talk about that in terms of how things are going.
Mm-hmm. Sure. So currently a lot of our services like art therapy, music therapy, those are all still suspended just because we want to keep folks as safe as possible. A lot of those supportive services require hands-on interaction or the sharing of equipment, art supplies, instruments, things like that. So those are still on hold just out of an abundance of caution. In regards to behavioral health, so whether that's social work, psychiatry, psychology, a lot of states have loosened some of the restrictions in terms of telebehavioral health. A lot of those were driven by Medicare and Medicaid. So previously they would require an in-person visit for that first visit. A lot of states have done away with that. So certainly if you're looking for behavioral health care and support, that's something that you could definitely do virtually at this time.
Let's see. Oh, here we go. Oh, another question. This one is for Diana. Do we exercise with a mask? What are your recommendations about that?
You know, I think this is evolving, right? If you are in your own home, you don't need one. If you're outside walking or running, I think as long as you can maintain that social distance of 6 feet, I think you're good. Now, we're opening up a can of worms. What does it look like when we go into a gym and it's not physical therapy, right? So you're doing one-on-one with me, we're still wearing a mask. I don't have the answer. I'm not sure yet, right? If you are compromised, your immune system's compromised, you're at high risk, I would be cautious. And maybe wear a mask or just choose a different way to exercise. I think we're going to be finding folks choosing different outlets to exercise. So maybe that treadmill or that elliptical that has been collecting dust is now your best friend. I mean, so yeah.
Then another question here about new moles. So I'll ask Mary this one. So do we ever stop getting new moles? Are all moles dangerous? Do we need to be worried about new moles?
Well, most moles traditionally develop in childhood or adolescence. That doesn't mean that every mole you develop is necessarily worrisome to be a melanoma or to be something, worrisome, but I think it's definitely worth being evaluated. Sometimes something that you might think is a mole might be something else completely. So I think if you have something you're concerned about or something's changing, kind of that E that I talked about, the evolution piece, definitely, bring it to the attention of your dermatology provider. Or any provider would be fine.
A question for you, Chung. So there have been a couple of things in the news about sunscreen and safety. So there's a study that showed that maybe there's some stuff that you might be able to find in the blood with sunscreen. Do you think sunscreen is absorbed and dangerous beyond the skin?
I'm sorry, say again.
So there's a question about sunscreen. And whether there are some questions that patients sometimes ask if sunscreen is safe, because there are a couple of news articles about finding certain chemicals that are from sunscreen in the blood. I don't know, Mary may be able to comment on this also.
So actually I looked up as well, and there are some ingredients that prohibit in certain countries that you have to look up. So we recommend any sunscreens that's approved by FDA that you can use. I believe that that's safe. And if you have allergies to certain ingredient or sensitive to, again, you have to try and trials and errors. Like a certain products that I got burned, I feel it's burned my skin, but I'm okay with certain products. And my colleague loves the products that doesn't fit on my skin. So you have to really find what's suitable on your skin.
A lot of those studies too, you had to use like 200 times the amount of what you would normally use when you're applying sunscreen to get any of those negative effects. So I think it's definitely advisable to wear sunscreen, and I'm pro mineral sunscreens. So they're good, better for the environment, if anything.
Yeah, I think in general I agree. The mineral sunscreens are, I think, a little easier for sensitive skin. But it just kind of depends. Chung makes a good point. I mean, it really depends on your skin. For some people, any sunscreen works. And for some people, you have to be a little bit more careful just for irritation, not because the sunscreen is harmful. Let me see. All right. So I think there's one more question I think that's worth addressing. And again, this is more Mary and Chung. If I feel a pimple-like bump on the back of the scalp of my head, should I be seen as soon as possible? I think that's a great question. People ask all the time about their bumps.
Well, you have, sebaceous glands on your scalp. So usually pimple-like bumps are usually a cystic structure or something benign. But if it's something that doesn't heal within a couple of weeks, it is probably something that, should be evaluated.
Chung, what do you think?
So if you have a history of skin cancers and that's in your mind all the time, I recommend to see someone as soon as possible. But just to follow the rules, A, B, C, D, E. If any moles, it can be new, but it can be something that you had that you didn't realize for a long time. So if any moles that change by A, B, C, D rules, or if anything bleeding, itching, changes over time, you need to see someone as soon as possible.
All right. I think you guys could ask questions forever, and there's still some ones that we would love to answer if we could. But I think we don't want to take you. I feel like the attention spans for probably most of you are waning, but you've stuck it through. Everybody who's out there, thank you for sticking it through all the way. I mean, we have definitely more. We have most of the people who started out with us, so that's amazing. I don't know about you guys. Yeah, but I had to
jump in for a second. So I want to thank everybody for joining. And as far as those questions that weren't answered, so that's why I'm jumping in.
Yeah.
So we have so AIM at Melanoma has a physician assistant that we offer for free. You can go to our home website and you'll scroll down, you'll see her picture, Melissa Wilson, and you can, there's a toll-free number. You can reach out to her by completing the form on the website. So if we did not get to your question, or if something comes up after the fact, I want to encourage everybody to reach out to her. We've received some inquiries regarding people wanting to go, wait a second, I forgot this, can you repeat? We did record this event, and so everybody who registered for the event will be able to receive, will receive the recording. So I should mention, and I apologize, the website address for AIM, I forgot you guys registered through Zoom, not through AIM at Melanoma. Normally we register through the website. So the AIM at Melanoma's website is www.AIMAT for at, you got to spell it out, melanoma, which we all can spell, .org. So it's AIM at Melanoma, all spelled out, .org, and you'll be able to find Melissa. You'll be able to find all the resources. I think like side effects management sheets. We have a Peer Connect program. We have a whole bunch of resources that is available. We also have another event coming up in about 3 weeks with Memorial Sloan Kettering. So there'll be information about that as well. And we're going to continue running these programs through the summer. There's a lot of stuff out there. So thank you. I want to thank the Cleveland Clinic. I want to thank all of the speakers, everybody who joined us. And just to remind you that there is going to be a survey coming out right after this event. Please go ahead and complete it, and that feedback will be very helpful. So thank you so much, everyone, and take care and be safe.
Thank you.
Okay, thanks, everybody.
Thank you.
Thank you.